Hello, I'm Sarah Dawkins, graduate student in the Communications 639 Strategic Issues Management class. The following issue management analysis reviews the fiscal year 2025 restructuring of Temporary Assistance for Needy Families, or also known as TANF. The restructuring purposes eradication of funding to the Department of Social Services Alternative to Abortion grant, which in turn funds multiple local agencies. Proposed TANF funding cuts directly impact the quantity and quality of services specifically at Lifehouse Crisis Maternity Home and the 38 southernmost counties of Missouri that they provide services to. The proposed analysis will employ the issues process model to discuss positively framing success of the agency while overcoming barriers of potential lost funding, lack of employee trust, and potential donor shed. In 2023, TANF decided to do the first funding analysis since 1975 and review the administration of federal taxpayer dollars, allegedly with large areas of funding outside the designated outcome measures. The federal government states maternity homes utilizing TANF funds are considered outside of the scope. It has failed to provide evidence-based outcomes supporting TANF's main purposes. One of the block grants funded specifically by TANF funding is Alternatives to Abortions. This fund is slated outside the scope of TANF's mission. Lifehouse Crisis Maternity Home is a local organization receiving A2A funds. Their mission is to provide a safe, nurturing home and supportive services for vulnerable, homeless pregnant women and their children under the age of 5. It is a women's transitional living facility offering 1 year of housing while receiving necessary pre- and postnatal care. The residents also receive comprehensive case management services, food, employment, education assistance, and parenting skills support for an additional year after their residency. A2A grant provides approximately 75% of the $1 million annual operating budget of Lifehouse's 2 locations in southern Missouri. A large portion of salaries and wages are covered by A2A funding. If funding is lost, unrestricted funds from donors and other grants would have to be identified to cover 3/4 of the annual operating budget. Internal impacts would include 24/7 staffing would no longer be available, full-time nurses could no longer be staffed, and donors would have to cover case management costs such as driving permits, licenses, daycare assistance, etc., until other funding sources could be established. There's also the possibility of closure of one of the facilities. External stakeholders such as the Homeless Coalition of Southwest Missouri, potential Lifehouse residents, law enforcement, and drug rehabilitation centers would also be impacted. Being the only housing option for pregnant women and their children under 5 would leave a vulnerable and critical need area unserved, leaving a pregnant woman and her child with very few safe haven options. Other emergency shelters do not provide entry to pregnant women or children. Lifehouse serves as the main reentry and transitional housing choice for incarcerated or rehabilitated pregnant females. Substance use treatment facilities and prisons would have to identify alternative housing options for these women, often leaving no transitional service available. Cost of civic services could increase due to more incarcerated bed nights and to higher use of emergency services for non-critical pregnancy concerns. This analysis employs the issues process model as identified by author Kirk Hallahan in journal article The Dynamics of Issue Activation and Response and Issue Processes Model. Preliminary analysis considers the movement of inactive and aware publics to active and aroused participants, ideally preventing legislative approval of the proposed TANF A2A funding cuts. The issue process model analysis includes theories and frameworks to analyze the issue from different perspectives, considering both internal and external factors, assessment of the framing efforts employed by stakeholders and the organization itself, critique of the effectiveness of the framing of these efforts, and identification of any biases or framing choices that may influence public perception. As indicated in Hallahan's diagram, internal and external factors can be assessed utilizing various methodology among each identified public regarding the effect of the funding issue and perceived importance movement of the party toward activism, which is the preventing of the TANF cuts. Public relation efforts for active aroused public's internal stakeholders may include consensus and confidence building, issue identification and labeling, organizing and coalition building, media advocacy, and lobbying. Public relation efforts for unaware, inactive publics may include prevention-based strategies, poll taking, performance monitoring, and quality assurance, finding ways to enhance public image through ingratiating and/or reputation enhancement. Analysis of intervention-based strategies include monitoring the issue, outreach cooperation, inquiry handling, co-optation, and containment. This analysis will review the following aspects of Catholic Charities of Southern Missouri's efforts in the following categories: strengthening performance and quality assurance measures, monitoring the outcome of TANF guideline changes and budget allocations, consensus and confidence building. While the main funding grant of Lifehouse Crisis Maternity Home is facing eradication from the FY25 state budget, Lifehouse has been strategically adding evidence-based performance and quality assurance measures to increase ability to apply and receive alternative grant funding. The two implemented strength-based social work strategies of Quality and Performance Initiatives, or QPI, utilized include the Arizona Matrix and the Safe Care Augmented programs. This implements quantitative and qualitative performance measurements into case management efforts while the mother is in transitional living and afterward. The Arizona Matrix includes housing, employment, income, food sustainability, child care, transportation, education, healthcare coverage, sobriety, social networking. 3 areas trained, evaluated, and measured or documented quarterly utilizing Safe Care Augmented program include positive parent-child interactions, child health, and home safety. The aim is to prevent child neglect and physical abuse. Both evidence-based strategies meet the Health and Human Services guidelines for home visiting, evidence, and effectiveness strategies. Implementing these performance metrics will open a diverse array of grant opportunities from the Department of Health and Human Services funding rather than just the Department of Social Services Alternatives to Abortion grant. Lifehouse Crisis Maternity Home should maintain close communication with Alternatives to Abortion's representative, Kim Dowd, for continual monitoring of the FY25 budget impacts. Other resources to access include Alliance for Life lobbyists, congressional representatives for bill details, and congressional movement. Catholic Charities of Southern Missouri executive leadership, in partnership with the Board of Directors, implemented polling strategies of employees. These 2023 surveys measured employee knowledge of grant funders, work-life balance, interaction with administration, and interaction with the community. Overall, employee satisfaction averaged 4 out of 5-point rating system. Grant funding ranked low on employee concerns, where high caseload numbers ranked as the highest concern. Minimal knowledge of funding resources was exhibited from those surveyed. The executive leadership team implemented all employees Zoom meetings to address topics of concern, plus the Lifehouse funding issue, and identified funding alternatives throughout the remainder of 2023 and 2024. Quarterly leadership team meetings and breakout sessions were also implemented to create subcommittees to address each topic in the surveys. Since research and analysis by Catholic Charities of Southern Missouri is ongoing, this analysis cannot determine a solidified outcome to the efforts. However, it is recommended that the executive leadership team continue to maintain transparent communication with employees and continue to seek their input as to alternative funding sources and donor relation efforts related to Lifehouse Crisis Maternity Homes longevity. The construction approach to framing suggests framing of a cause is external to an individual and is cultural rather than internalized and personal. Differentiation from schematics should be noted, as cultural framing is when schema is identified as an individual's personal experiences and feelings. Hence, a frame is opposite. It is a stable part of culture that constructs social reality and changes very little over time and is extrinsic to individual personal beliefs. Framing devices include word choice, exemplars, descriptions, arguments, visual images, and they should provide interpretation, definition, and causal relationship. Lifehouse Crisis Maternity Homes Development Department does an excellent job of maintaining and building upon traditional constructs of home and family. The social institution, although changing dynamic in America, is still largely defined as a mother, father, and offspring produced as a result of a marital relationship. This social construct has minimally changed over time. Framing examples Lifehouse uses and excels in soliciting private donations with include the following: word choice and descriptions. Exemplified by their website, Lifehouse utilizes words that encompass the inherent value of mother and child while integrating safety of home and belonging. Quote, their Lifehouse website says, Lifehouse is a residential program for pregnant women experiencing homelessness aged 18 or older. Each resident can have one child under the age of 5 with them. The mission of Lifehouse is to provide a safe, nurturing home and supportive services for women who have chosen life for their unborn child. Lifehouse is not just a shelter, but a comprehensive program with the goal of creating a better life for mother and child. Lifehouse provides case management, food and shelter, counseling, and so much more. A motto commonly used during donor events such as Life at Night is Lifehouse Changes Lives. Developing this context to reference the deficit between grant funding and basic needs, framing the concept of how a mother's life is changed and a healthy, happy baby can be rewarding. Hundreds of thousands of dollars is raised annually to combat funding deficits. During the next donor event, Lifehouse would greatly benefit from employing these strategies but identifying indirect cost needs such as salaries to be covered. It is recommended that the funding concern be framed to donors in a positive approach to develop an ongoing donor-advised fund that will fund case management salaries for perpetuity. Utilizing this framing approach as well, the new Capital Funds campaign for Lifehouse Springfield renovations could experience vast growth and movement toward their funding goals. Visual images of mothers and children permeate the Lifehouse maternity homes in Springfield and Cape Girardeau. During fundraising efforts and special events, photos of actual residents and their children are emotionally appealing to all attendees. To enhance the experience of a video is available to personalize the frame of why. It is recommended that more publicity efforts be made to frame the context of the why of Lifehouse into the larger social scheme of society. Framing the effort should not only be housing a mother and babies at a local needs level, but provide the big picture of the true battle, which is maternal and infant mortality. Missouri is second in the nation in high infant and maternal mortality rates and is usually hidden rather than exposed. Perhaps it's a shock value, but educating the public on the true social reality that threatens the ideal social construct might activate unaware publics. Many biases may also lead to donor callous, and a new context be enough to activate this inactive group of publics. Two biases to be overcome include the Catholic Church's pro-life stance and many aware publics being Catholic Church members who are encouraged to donate to many different sectors of Catholic funding. More liberal state congressional members currently serve in Missouri Congress, and the connotation of abortion as a hot topic trigger for policy making. Instead of relating to the trigger of anti-abortion, framing could be strategically implemented to relate to reduction in Medicaid expenditures, death rates of mothers, and higher birthing outcomes for African American women. The identified internal and external stakeholders will greatly benefit from the framing of reality being added to the frame of optimistic vision. More clearly labeling and identifying the issue of maternal and infant mortality may be the wake-up call employees and congressional members need across the sector here to see their contribution to maternity home efforts while providing grantors and politicians with a scope of what exactly maternity homes are combating and why. Using the issues process model and the construction approach to framing, the following is recommended. Utilize findings from evidence-based case management to apply for alternative grant funding sources, such as the Health and Human Services Department. Maintain in-depth communication with coalition and lobbyists such as Alliance for Life and Missouri Right to Life as well as alternatives to abortions. The executive leadership team should continue efforts of transparent communication with frontline staff of Lifehouse Crisis Maternity Home as to any updates or changes to funding. They should also continue polling efforts regarding internal culture. The executive leadership team will see great benefit by providing education opportunities to all frontline staff as related to grant funding guidelines and insight to the newer strategies of implementing evidence-based case management approaches through workshops, seminars, staff training, etc. Development efforts with donor recruitment, retention, and involvement should continue utilizing frameworks related to widely accepted cultural constructs of family, but also consider implementing more spotlight on the larger issue at hand and the truth of how Missouri is working to overcome the above national average rates of maternal and infant mortality. Thank you for considering this issue management analysis, reviewing the fiscal year 2025 restructuring of TANF and the impacts of the A2A state block grant, and ultimately the operation of Lifehouse Crisis Maternity Home.